Last night you made dinner. You had leftovers. You put them in a container, stuck them in the fridge, and today you pulled them out and reheated them for lunch. You do this every single week, maybe every single day. And you have never once questioned it because the food looks fine, it smells fine, it tastes exactly the way it did last night. Here is what nobody is telling you clearly enough. Certain foods, when they are reheated, undergo chemical and structural changes at the molecular level that your body was never designed to process. These are not rare ingredients. These are not exotic superfoods from a specialty store. These are foods sitting in nearly every American refrigerator right now. Chicken, rice, potatoes, processed meats, foods you grew up eating, foods you feed your family without a second thought. And the damage they cause does not announce itself. There is no food poisoning, no stomach cramps, no obvious warning sign. It works quietly, over months and years, on your blood vessels, your blood pressure, your inflammatory markers, and your heart. After 50, when your cardiovascular system is already operating with less margin for error, when your arteries are already stiffer and your endothelium, the protective inner lining of your blood vessels, is already more vulnerable, these hidden chemical stressors become genuinely dangerous. Nobody at your next doctor's appointment is going to ask you how you handle leftovers. That conversation does not generate revenue, but it should happen, because what you are about to hear directly affects your cardiovascular risk. Today I am going to walk you through 4 common foods you should never reheat, explain exactly what happens inside them when you do, and tell you what to do instead. Let us start with a concept that changes everything. Most people think reheating food is simply cooking it a second time. It is not, and that misunderstanding is where the real danger lives. When you cook food the first time, you apply heat to raw ingredients with a specific intact chemical structure. Proteins denature, meaning they unfold and reconfigure in a controlled way. Starches gelatinize, they absorb water and soften. Fats render and separate, that is normal cooking. Your body knows exactly how to handle those results. But the moment that food cools down and sits in your refrigerator for hours, its chemistry begins to shift. Starches undergo a process called retrogradation. They reorganize into tighter, more crystalline structures that your digestive system handles differently. Fats begin to oxidize, especially polyunsaturated fats, forming compounds called lipid peroxides, which are molecules that directly damage cell membranes and blood vessel walls. Proteins can cross-link and become harder for your body to break down. And bacterial colonies, even in a properly cold fridge, begin to multiply and release metabolic byproducts into the food. Now you take that chemically altered food and you apply heat again. You are not restoring it to its original cooked state. That is the critical point. You are heating a different substance, and that second round of thermal energy creates entirely new compounds, some of which are inflammatory, some of which are measurably toxic, and some of which directly interfere with how your blood vessels regulate pressure and blood flow. This is not about food tasting a little different on day 2. This is about food becoming a different chemical product at a level you cannot see, cannot smell, and cannot taste. That is precisely what makes it dangerous. Your senses cannot protect you here, only information can. Here is the first food, and it is in almost every kitchen in America. The first food category, and arguably the most dangerous, is anything cooked in oil that gets reheated. Fried chicken, stir-fried vegetables, pan-seared fish, anything where oil was the cooking medium. Here is the chemistry. When cooking oils are heated the first time, especially past their smoke point, they begin to break down through a process called thermal oxidation. Polyunsaturated fats are the most vulnerable. They form aldehydes, specifically compounds like 4-hydroxynonyl and malondialdehyde. These are not obscure laboratory chemicals. They are well documented in cardiovascular research as direct contributors to endothelial damage, meaning injury to that protective inner lining of your blood vessels we discussed earlier. Now you refrigerate that food and reheat it the next day. You are subjecting already degraded fats to a second thermal cycle. The concentration of those toxic aldehydes does not stay the same, it increases. Studies have measured aldehyde levels in reheated cooking oils at 2 to 3 times higher than in freshly heated oil. What do these compounds actually do inside your body? 3 things. First, they promote oxidation of LDL cholesterol, the form of cholesterol most people know as bad cholesterol, making it far more likely to embed in your artery walls and form plaques. Second, they trigger inflammatory cascades throughout the vascular system. Third, they reduce the availability of nitric oxide, the molecule responsible for keeping your blood vessels relaxed and flexible. After 50, when your arterial walls are already less elastic and plaque buildup may already be underway, adding reheated oxidized fats into the equation is like pouring accelerant on a slow fire. You are not causing a new problem. You are dramatically accelerating one that already exists. The rule is simple. If you cooked something in oil, eat it fresh. If it sat overnight, that fat has changed, and reheating it only makes it worse. The second food will surprise you. Rice. Plain, ordinary, white or brown rice. This one catches nearly everyone off guard because there is nothing inherently dangerous about rice. The danger has nothing to do with the grain itself. It has everything to do with a bacterium called Bacillus cereus. Bacillus cereus is commonly present in uncooked rice as dormant spores. When you cook rice, the heat kills the active bacteria, but the spores survive. They are heat resistant. They are designed to survive extreme conditions. As the rice cools down and sits, whether at room temperature on your counter or even in a properly cold refrigerator, those spores germinate and begin producing toxins. One of those toxins is called cerealide, and here is the part that matters. Cerealide is heat stable. That means reheating the rice does not destroy it. You can microwave that rice until it is steaming hot, and the toxin remains fully active. The heat that you trust to make the food safe again does nothing to the compound that is actually causing the harm. In the short term, cerealide causes gastrointestinal distress. But for this audience, the cardiovascular relevance is what I want you to understand. Repeated exposure to low-grade bacterial toxins creates a chronic inflammatory burden on your system. Your liver processes these toxins, and in doing so, it produces inflammatory cytokines, signaling molecules that circulate through your bloodstream and contribute to systemic inflammation. Chronic systemic inflammation is one of the primary accelerators of atherosclerosis, the progressive buildup of plaque inside your arteries. For someone over 50 who is already managing blood pressure, cholesterol, or early cardiovascular changes, this kind of invisible inflammatory load is exactly what tips the balance from stable to dangerous. The rule here is firm. Cook rice, eat it that meal. If you must store it, refrigerate it within 1 hour and consume it within 24 hours. But understand that reheating still carries risk. Now, the third food on this list. The third food, processed meats. Bacon, sausages, deli meats, hot dogs. These are already among the most chemically modified foods in the average American diet, and reheating them takes that problem to an entirely different level. Processed meats contain preservatives called nitrates and nitrites. They are added to prevent bacterial growth and maintain that familiar pink color. In their original form, these compounds are relatively stable. Your body can handle them in moderate amounts, but when processed meat is reheated, especially at high temperatures in a microwave or a hot skillet, those nitrites convert into nitrosamines, a class of compounds classified as probable human carcinogens. Most people have heard that part vaguely. What almost nobody discusses is the cardiovascular mechanism. Nitrosamines cause direct oxidative stress in the walls of your blood vessels. They impair the function of your endothelium, and they interfere with your body's ability to regulate blood pressure through the nitric oxide pathway. The names sound similar, but the functions are opposite. Nitric oxide is the molecule that relaxes your blood vessels and protects them. Nitrosamines damage them and make them stiffer. One keeps your arteries flexible, the other accelerates the exact process that leads to hypertension and plaque formation. Reheating processed meats increases nitrosamine formation significantly compared to eating them freshly cooked. For someone already on blood pressure medication or someone with a family history of heart disease, this repeated exposure is not trivial. It is cumulative. It adds up quietly, meal after meal. The rule is straightforward. If you eat processed meats at all, eat them once, freshly prepared. Never reheat bacon, sausage, or deli meat. And if you can reduce your processed meat consumption altogether, even better. But at a minimum, never twice cook it. And that brings me to something I need to say directly. You have just learned something that most people never hear from their doctor. 3 categories of food that you probably eat every single week are quietly generating compounds that damage your blood vessel walls, promote plaque formation, and increase your cardiovascular risk. That is not a small thing, and it raises an important question. When was the last time you actually had your heart health evaluated? Not a quick blood pressure check at the pharmacy. A real screening. A real conversation about your specific risk factors, your blood vessels, your inflammatory markers. Most people watch a video like this, feel concerned for a few minutes, and then go right back to their day. Nothing changes, nothing gets checked. But you can actually take action right now. There is a free platform called Care Health that connects you with healthcare options in your area, cardiac screenings, blood pressure monitoring programs, clinical trials for new heart disease treatments. You fill in a short form, date of birth, gender, a couple of basic questions. It takes about 30 seconds. No cost, no commitment. Care Health matches you with relevant options near where you live. Click the link in the description or scan the QR code on screen. Just open your phone camera and point it at the code. I will tell you what I tell every patient who sits in my office. Information without action is just entertainment. You now have the information. This is the action step. Use it. Now back to what you need to know, because the fourth food on this list is the one nobody suspects. The fourth food, potatoes. And this one is the most deceptive of all because it involves a process that actually starts out as something beneficial. Potatoes are one of the highest glycemic foods in the average diet. When freshly cooked, the starch inside them exists in a form called gelatinized starch. Your body breaks it down rapidly. Blood sugar rises fast. That is normal potato behavior, and your body manages it. Now here is where it gets interesting. When cooked potatoes cool down in the fridge, some of that starch converts into what is called resistant starch. Resistant starch is digested more slowly and causes a smaller blood sugar spike. That is actually a positive change. So far, so good. But when you reheat those potatoes, the starch structure shifts again. It partially reverts, partially forms new complexes. The glycemic response becomes unpredictable, and your body no longer processes it the same way it did the first time around. And here is the part that matters most. If those potatoes were cooked in butter, oil, or any fat, which they almost always are, the reheating cycle oxidizes those fats. The same lipid peroxides we discussed earlier with fried foods. Now you have a high glycemic, unpredictable starch combined with oxidized fat in the same meal. That combination is particularly damaging for anyone with insulin resistance, prediabetes, or type 2 diabetes, conditions that affect a massive percentage of adults over 50, often without diagnosis. Elevated blood sugar plus oxidized fats is a direct 1-2 punch to your endothelium. One raises the demand on your blood vessels. The other damages their ability to respond. The practical rule: eat potatoes fresh. If you have leftovers, eat them cold. A potato salad actually preserves the resistant starch benefit, but reheating them, especially if they were cooked with fat, reverses that benefit entirely and adds new risk on top. That brings up a question I hear constantly. At this point, many of you are thinking the same thing. Does it matter how I reheat the food? Microwave versus stovetop versus oven. Surely one method is safer than the others. The honest answer is that the method matters far less than the decision to reheat at all. The core chemical processes we have been discussing, lipid oxidation, nitrosamine formation, bacterial toxin stability, these occur regardless of the heat source. Heat is heat. The chemistry does not care whether it comes from electromagnetic radiation in a microwave or a gas flame on a stove. That said, each method carries its own specific problem. Microwaves create uneven heating. Parts of the food reach very high temperatures while other parts remain cool. The hotspots accelerate chemical degradation in those zones, generating higher concentrations of toxic compounds in specific pockets of the food. Meanwhile, the cool spots may not reach temperatures sufficient to kill bacteria that grew during refrigeration. You get the worst of both situations in a single meal. Stovetop reheating, especially in a pan with oil, adds a second fat oxidation cycle on top of the oxidation that already occurred during storage. You are now layering fresh lipid peroxides over the ones that formed overnight. Oven reheating is the most even of the three, but it does not eliminate the fundamental chemical changes that took place while the food sat in your fridge. It heats a chemically altered substance more uniformly. That is all. For the 4 foods we covered today, the safest option is not reheating them at all. It is not about finding the right appliance. It is about understanding that the damage occurs during storage and is amplified by any form of reheating. The method is secondary. The decision is what matters. Now let me put this entire picture together for you. Let me pull back from the individual foods and show you the full picture, because this is the part that matters most after 50. At 30, your body has enough regenerative capacity to absorb the occasional hit. Oxidized fats from reheated oil, a dose of bacterial toxins from leftover rice, nitrosamines from twice-cooked bacon, a glycemic spike from reheated potatoes. At 30, Your endothelium repairs itself quickly. Your liver clears those toxins efficiently. Your inflammatory response activates, does its job, and resolves. The system recovers. No lasting damage. After 50, every single one of those systems operates with less margin. Endothelial repair slows down. The cells that line your blood vessels take longer to regenerate, and they regenerate less completely. Your liver processes toxins more slowly, which means harmful compounds circulate longer before being neutralized. And here is the one that matters most. Your inflammatory response stops resolving the way it used to. Instead of activating, clearing the problem, and shutting down, inflammation becomes low-grade and chronic. It persists. It accumulates. It becomes the background noise of your cardiovascular system, quietly accelerating plaque formation, arterial stiffening, and hypertension. One reheated meal means nothing. I want to be clear about that. This is not about a single plate of leftover fried chicken ruining your health, but reheating leftovers daily, month after month, year after year, creates a cumulative toxic burden. Each meal is a small insult. Individually insignificant. Collectively, it is the kind of slow, invisible pressure that drives heart disease, hypertension, and stroke. I am not telling you this to create fear. I am telling you this the same way I would explain a risk factor to a patient sitting in front of me. It is not about perfection. It is about knowing which small daily habits carry disproportionate risk and making informed choices about them. Here is exactly what to do. This does not require a dramatic lifestyle change. It requires 6 simple rules for how you handle food after it is cooked. Rule 1. Cook appropriate portions. The simplest way to avoid reheating food is to not have leftovers in the first place. This is not about wasting less food. It is about cooking the right amount. Smaller batches, eaten fresh, are safer than large batches reheated over 3 days. Rule 2. If you do have leftovers, eat them cold when it is safe to do so. This will surprise many people, but cold leftovers are often the better option. Cold potato salad preserves the resistant starch benefit we discussed. Cold chicken on a salad avoids reoxidizing the fats it was cooked in. Cold rice dishes are common in many cultures for exactly this reason. Skipping the reheat skips the second thermal cycle entirely. Rule 3. Store leftovers correctly. Into the refrigerator within 1 hour of cooking. Sealed container, coldest part of the fridge. Consumed within 24 hours maximum. The longer food sits, the more bacterial toxins accumulate, and the more fats oxidize, even in cold storage. Rule 4. Never reheat anything more than once. If you reheated it and did not finish it, discard it. A third thermal cycle on food that has already been chemically altered twice is not something your body needs. Rule 5. Separate the fat. If you cooked something in oil or butter and you plan to store the food, remove as much of the fat component as possible before refrigerating. Less fat in storage means fewer lipid peroxides forming overnight. Rule 6. When in doubt, throw it out. The cost of one discarded meal is always less than the cost of chronic cardiovascular inflammation. 2 more things you need to understand before we finish. Most conversations about heart health focus on 3 things: cholesterol medications, blood pressure pills, exercise, and those matter. I am not dismissing any of them, but they are not the complete picture, and the part that is missing is sitting in your kitchen right now. The daily repetitive choices you make about food, how you store it, how you handle it after it is cooked, whether you reheat it, those choices create a cumulative effect that either supports everything else you are doing for your cardiovascular system or quietly undermines it. Think about this. You can take your statin every single morning, you can walk 30 minutes every single day, you can monitor your blood pressure religiously, and then you sit down to a plate of reheated fried chicken that floods your bloodstream with oxidized lipids and inflammatory compounds. Those 2 efforts are working directly against each other. One is trying to protect your blood vessels, the other is actively damaging them, and you do not even realize there is a conflict because nobody ever framed it that way for you. The point is not to make you afraid of your own kitchen. The point is to understand that your kitchen is a clinical environment, whether you think of it that way or not. The same principles that govern how a hospital handles food safety, temperature control, time limits, avoiding recontamination, those apply to your home. The biology does not change because you are standing in front of your own refrigerator instead of a hospital food service line. You just never had anyone explain it to you in those terms. Small adjustments in how you handle food after it is cooked can meaningfully reduce the invisible inflammatory load your cardiovascular system carries every single day. Not dramatic changes, not expensive changes, just informed ones. Let me bring everything together. 4 foods, 4 mechanisms, all of them invisible. Reheated cooking oils and fried foods generate toxic aldehydes that directly damage artery walls and accelerate plaque formation. Reheated rice carries heat-stable bacterial toxins that your microwave cannot destroy, driving chronic inflammation that burdens your cardiovascular system month after month. Reheated processed meats produce nitrosamines that impair endothelial function and interfere with the nitric oxide pathway your body depends on to keep blood vessels relaxed and flexible. And reheated potatoes, especially when cooked with fat, create an unpredictable glycemic and oxidized fat combination that hits your endothelium from 2 directions at once. None of these risks require dramatic life changes to address. They do not require expensive supplements, special equipment, or a complete overhaul of how you eat. They require awareness. They require a few simple adjustments in how you handle food after it leaves the stove. Cook the right amount, eat it fresh, store it properly, and when in doubt, throw it out. Your heart does not care whether you intended to cause damage. It does not care whether you knew. It only registers the chemical environment you create inside your body, meal after meal, day after day. Now you know. That changes what happens next. And remember, that free heart health screening link is in the description. 30 seconds could make a real difference. Take care of yourself.